Hello everyone and welcome to short revision series, the part third for Neet PG 2022. So we will be talking about the glucose transporters and the locations. So location GLUT1 transporter, the locations are the brain, RBC, placenta, kidney and colon. So these are very much asked, brain, RBC and placenta, and their function is basal glucose uptake. Now GLUT2, liver, pancreatic, B cells, small intestine and kidney. Now they are what their function is: rapid uptake, release of the glucose. Now GLUT3 specifically present on neurons and high affinity for glucose. Now GLUT4, they are present in heart and skeletal muscle, adipose tissue, and their function is insulin dependent glucose uptake. GLUT5, small intestine, testes and sperms, and their function is fructose transporter. GLUT8 is present on blastocytes, and this is very much asked. GLUT9, they are in liver and kidney, and their function is urate transporter. So they all are very important to remember, and each of them are very much asked. So try to memorize all of them. Now mitochondrial membrane and associated enzymes. So enzymes of the inner membrane, see the inner membrane, and they are electron carriers 1 to 4, ATP synthetase and membrane transporters. Now enzymes of the mitochondrial matrix, so citric acid cycle enzymes, beta oxidation enzymes and pyruvate dehydrogenase. This is very much asked. It is present in the mitochondrial matrix. Now enzymes present in the outer membrane enzymes are acyl coenzyme synthetase, glycerophosphatase and acyl transferase. These are present in outer membrane. And now question is asked, non-cultivative intracellular bacteria. So the mnemonic is cream. So Chlamydia, Rickettsia, Escherichia, Anaplasma and M. leprae. So these are non-cultivative intracellular bacteria. Now abdominal muscles and their actions. So forward flexion of the trunk, lumbar spine, it is due to the rectus abdominis and bilateral internal oblique and external oblique. Now lateral flexion of the trunk is due to ipsilateral contraction of the internal oblique and external oblique. Now rotation of the trunk is due to the contraction of ipsilateral internal oblique and contralateral external oblique. Ipsilateral internal oblique and contralateral external oblique. This causes rotation of the trunk. Now this muscle tenses pyramidalis, tenses the linea alba. So pyramidalis tenses the linea alba. Now pulls testes toward the superficial inguinal ring, and this is done by cremaster muscle. This is very much asked, very important. Now difference between MHC class 1 and MHC class 2. See, now MSC class 1, they are present on all nucleated cells except the sperms. So except thing you should remember, and it is present on platelets, and they are present on APCs, antigen presenting cells, and they are endogenous peptides. They are antigen to CD8 plus T cells. They are exogenous peptides. They are antigen to CD4 plus T cells. Now they are the antigen X via cytosolic pathway. They are antigen X via endocytic pathway. So this is how very important topics I have discussed, and you need to remember that. And almost one question is asked every year from these topics. So please try to remember this and stay tuned.